Stonebridge College by Joseph Scheibert, which is me. And, next slide. An outline of different concepts of health. In Western society, emphasis is placed on the health of individuals, and good health is seen as a vital component of a successful society. Sociologists, by gathering statistics and conducting research, have developed broad concepts and models within healthcare. The World Health Organization states that health is a state of complete physical, mental and social well-being, and not merely the absence of disease or infirmity. There are negative, positive and holistic concepts of health. The negative concept focuses on a specific disease, reductionism, where the positive and holistic concepts see disease as a possible outcome within a much broader context. Negative concept. The negative concept is often a self-definition of health, rather than a professional one. In this model, a person considers themselves healthy until they succumb to disease. Good health equates to the absence of illness despite poor lifestyle choices or an adverse health environment. This negative concept can never truly provide the complete picture of a person's health prospects, as it is built on an illusory assumption of present good health. Positive concept. In the positive concept, a person will take responsibility for their health and be proud of it. This will include a good diet, regular exercise, and early and cooperative engagement with healthcare professionals. As a consequence, such persons are less likely to suffer disease and more likely to recover well if they do. Psychologists and sociologists suggest that optimism, confidence, and positivity can help people live longer and make them less likely to succumb to severe illness such as heart attacks. Hark L. and Keltner D. 2001 looked at women's yearbook photos and found that women with genuine smiles had more marital satisfaction 25 years later. Other research has yielded similar results. Gregory Bachanchan, a graduate student at the University of Pennsylvania, separated two groups of 16 men who had heart attacks. One group was assessed as optimistic and the other group pessimistic. 8.5 years later, they looked at the groups and found that only 5 of the optimistic group had died of a further heart attack, while 15 out of the 16 in the pessimistic group had perished. Holistic concept. The holistic concept focuses on mind as well as body and assesses the physical health, intellectual health and emotional health and social health, the opposite of reductionism. The holistic method emphasizes observation of a patient's lifestyle as an addition to the traditional biomedical approach. Rudolf C. Heredia, 1990, said cardiac ailments are strongly correlated with diet and stress, and goes on to say alcohol and tobacco abuse, narcotic and pharmaceutic addiction are also major perpetrators of ill health. All these are clearly associated with socially conditioned lifestyles. Heredia highlights the importance of social influence, stress, lifestyle and diet. The narrow clinical gaze is replaced with broader overview of these other factors, acknowledging all aspects of a patient's lives. Doctors encourage the individual to make suitable changes that will improve their health through lifestyle or diet. An example is the stance on smoking. In Western society, and increasingly elsewhere, smoking is discouraged, and in the United Kingdom there are even free resources to aid smokers in their cessation. The holistic concept is criticized by some for creating ambiguity and confusion in treatment where a reductionist approach focuses deeply on a specific condition. Concerns are raised that distracted by alternative methods, essential interventionist treatment is missed. Sociological perceptives in health. Positive attitudes benefit long-term health and satisfaction. Talcott Parsons, 1951, Functional Concept of the Sick World, described the rights and responsibilities of those who are ill. People who are unwell should not be expected to be able to contribute to society normally and are given time to get back to good health. Society accepts this where the person takes responsibility for their rehabilitation. However, less sympathy is extended to sick people who are considered more responsible for their illness. Thus, an alcoholic or an overweight person who does not try not to make lifestyle changes will get less sympathy than a woman with breast cancer. Marxist conflict theory sees many sick people as victims of exploitation by the bourgeoisie. Thus, in the US, prosperous people have free access to healthcare where the poor do not. Feminist theory also asserts inequality in the healthcare system, as women generally must pay for feminine hygiene products and are more reliant on the healthcare system, for example having to go to hospital to give birth. Even with a positive attitude to health, a poorer person may have less access to good quality healthcare and worse health outcomes. How are health and illnesses socially constructed? Social constructivism can involve the labeling of the patient as being in poor health. Frieden, 1970, said, when a physician diagnoses a human condition as illness, he changes the man's behavior by diagnosis. A social state is added to the biophysiological state by assigning the meaning of illness to disease. It is in this sense that the physician creates illness, and that illness is analytically and empirically distinct from mere disease. Frieden asserts through diagnosis the doctor assigns illness to the patient, whilst biomedical perspectives suggest scientific objectivity. From a sociological point of view, there are observable changes in attitude or outlook after a diagnosis, not just in the patient but in others. Examples of social constructivism. Eli Sommer coined the term maladaptive daydreaming, or MD, to describe a person with a dissociative mental condition who daydreams for many hours a day. Dr. Ettik Klinger agreed that what Sommer described could be a condition, but goes on to say, "I would not like to see us create another dubious category for daydreaming that an individual regards as maladaptive." Rebecca Cam, 2017. Klinger also suggests that it is not a unique disorder and it overlaps with other disorders such as depression or OCD. Therefore, treating MD as a specific condition rather than a symptom may lead to the doctor to fail to treat the underlying mental illness, which may, for example, be depression. Another example, coined by Ivan Illich, is iatrogenesis, which describes medical intervention that worsens the illness by, for example, undermining the patient's self-help mechanisms. Thus, it can be argued that Sommer's diagnosis medicalizes a condition and inadvertently creates a negative and reliant patient whose own drive to resolve their issue is weakened. Cultural differences in health. Illnesses are interpreted differently in different societies and at different times. In medieval Britain, where belief in witchcraft was common, epilepsy was seen as a sign of satanic possession. Today, cultural factors remain prevalent, and in Britain we consume more alcohol per capita than the European average at 21.8 for men and 7.6 for women, compared to 18.3 and 4.7. Despite widespread knowledge of the dangers of drinking, there remains a widespread feeling that socializing with alcohol and getting drunk is acceptable. In contrast, many countries where Islam is the dominant religion frown on and punish drinking, which is considered blasphemous. Smoking, on the other hand, is seen much more as a social activity. Different cultures impose different social pressures, even at the expense of individuals' health prospects. Socio-economic effect on health. Etiology, the cause of disease, is not always clear. Illnesses are attributed to socio-economic differences. Some illnesses are more likely to affect poorer people, due to difference in lifestyle and diet, or due to physical or mental stresses, such as worries over money. Sociologists refer to the drift hypothesis, where people taken with ill health often drop social class as they are unable to work. This suggests that illness is a potential cause of poverty as opposed, or more likely as well as, poverty being the cause of illness. Societal pressures can cause illness, and those who are unwell can be stigmatized and lose status. Although this may be true for some societies, it is at present a contested hypothesis due to lack of statistical evidence. An awareness of this interaction between society and health is sometimes termed social imagination, and can be an important consideration in working out a viable healthcare plan and how that will fit into the individual's personal circumstances. Implications of CAM therapy on healthcare. The implications of CAM therapy on healthcare practice are varied. There are pros and cons to them. For example, meditation has been proven to improve a brain's cognitive development. In a study conducted by a team at Massachusetts General Hospital, they found that there were observable cognitive differences after an 8-week course of meditation. The analysis of MR images, which focuses on areas where meditation-associated differences were seen in earlier studies, found increased grey matter density in the hippocampus, known to be important for learning and memory, and in structures associated with self-awareness, compassion, and introspection. This has shown that some CAM therapy has a positive impact on healthcare practice and patient outcomes. Meditation is widely endorsed even by doctors working traditionally. Alternative approaches to medicine and their impact on the healthcare practice. Alternative approaches to traditional biomedical intervention are becoming more prolific in Western society, with an increase in America above the usage of complementary and alternative therapies (CAM) from 427 million in 1990 to 629 million in 1997. This has created tension between the efficacy of traditional as against alternative therapies with a wide spectrum of opinions. Biomedical approach. From a biomedical perspective, many CAM therapies are considered unsupported by empirical evidence or even fraudulent. CAM therapy such as homeopathy is considered by most doctors to be an unviable treatment, as there has been extensive investigation of the effectiveness of homeopathy. There is no good quality evidence that homeopathy is effective as a treatment for any health condition. The implication is that patients may seek CAM therapies instead of proven and prolific treatments. For example, people may look to homeopathy instead of getting vaccinated, causing the spread of disease. Progressive approach. In contrast to the biomedical approach, the progressive perspective supports both CAM and traditional methods, integrating them into a more holistic treatment plan. Findings by Ernst, Willoughby and Weimar found that most people using CAM do so alongside, and not instead of, biomedical treatment. Even if there is no proven efficacy for the CAM treatment, it may have a beneficial placebo effect and reduce stress. Though there are CAM therapies that do not have significant evidence of their legitimacy in helping treat illness, for example mindfulness meditation has been recorded to positively impact the patient cognitively and in consequence making the patient more relaxed and able to deal with mental illness and stress. CAM, positive or negative. Despite major criticism of many CAM therapies, there is evidence that some are at least beneficial, and there can be positive implications for healthcare practice, at least where traditional treatment is not abandoned. The danger for patients who rely on CAM therapies only, such as anti-vaxxers, is that disease may develop or spread, especially to children where it might have been successfully treated or prevented from infecting others. CAM seems here to stay, but with the focus on complementary rather than alternative. So references and bibliography. Thank you for watching my presentation. Take care.